It's not a secret that an important aspect to improving your overall health, and in some cases preventing or even reversing diabetes, is appropriate weight management. Now, while there are no magic pills or potions that will fix everything all at once, there are a growing number of options that help you to get on the right track. And here's one that is helping to lead the way.
Qysimia was one of the first medications approved for chronic weight management because up until then, we were treating complications of obesity. But now we're going after the source. Therefore, we're talking about obesity and Qysimia. I've had patients on this medicine for more than a decade. Even though other therapies have become available, they have remained on Qysimia simply because it has worked for them.
When I first started working to lose weight, I had blown my knees out, and the doctor said, you know, you have to lose 100 pounds before I'll even consider doing the surgery on you. I lost 110 pounds, and the doctor did the surgery, which helped so much because that made exercise that much easier. My doctor said there's this drug that will help you with your weight management.
Peter's example is not unique. So he's one of many people on Qysimia from day one, but because of diabetes, he's going to tell you he has been on several GLPs. Now he's on one of the newest iPhone, but Qysimia never went away.
I've been able to maintain the goal weight I had, which was to get back to what I was when I was able to ride my bike, and I'm back there.
For the first time, we know that if you have some degree of weight loss, you don't need to really necessarily return back to your high school weight and get into your prom dress, but a 5 to 10% weight loss will actually reverse the definition of metabolic syndrome in a number of these patients. And for the first time, we actually have therapeutic strategies that can help us achieve these goals.
If you're out there and you're looking at this, you can do it. It's unbelievable, the change that's happened to me in the years that we've been together. And I owe my life to him.
Very interesting stories. This once daily oral medication has been around for over 10 years. Joining us to discuss and share more of the success is Dr. Dina Peralta-Reich and Vivus CEO John Amos. Thank you guys for being here.
Thank you.
So how does this, there's a lot of talk about weight loss pharmacology these days. How does this fit into the spectrum?
It fits right in. It's perfectly, especially with what we've been seeing in the world right now going on with obesity. This medication is a great alternative.
The last couple of years, things have really changed. And then Elon Musk in 2022 told everybody, I'm the smartest guy in the world and I'm taking pharmaceuticals to lose weight. And it kind of changed, on a global basis, it changed the attitude around pharmaceuticals.
There's a lot of concern about safety of pharmacological agents now. How have you found using it?
The medication is FDA approved for 12 years old and above. Very comfortable using it with adolescents, young adults, and adults. Like any weight loss medication, you need to have the right assessment, make sure that it's the adequate medication for you, be able to communicate with your patients, close follow-up, and educate your patients on what possible side effects you need to watch out for.
You know, I'm a big fan of behavior change and exercise, and I'm assuming you guys emphasize that. This is just an adjunct.
100%.
Yeah.
For all my patients, any patient that I put in any weight loss medication, lifestyle modifications is a must. And very close follow-up, and we monitor body composition analysis too, because especially if it's a younger patient or an older patient, it doesn't matter. We want to make sure that what we're aiming is fat loss.
There's patients who are really dedicated to their health, resistant training, working out.
Yeah.
And then there's another group of patients that are like, I just want to do something simple that, you know, a once a day oral pill is something that allows me to make the behavior change, to see some fairly significant improvements in your lifestyle.
So start with the basics.
Start with the basics, and like, I don't need you to run marathons. I don't need you to be lifting, 100 pounds, but I need you to start with something, especially if they were sedentary to begin with.
So how does Qysimia work?
Well, Qysimia helps regulate and control appetite, and hunger.
But people worry that they're going to starve then, and they'll lose muscle if they starve.
Exactly. But so we start at very low doses, and then we gradually start increasing them according, how the patient is responding.
So it's a reduction in calorie intake, but it's not starvation.
Correct.
Able to maintain muscle, lose fat. Right?
Yeah, exactly.
Absolutely.
I assume the goal is to get people off pharmaceuticals.
Absolutely.
ultimately.
Yeah, I think what we're really focused on as a company, and I think everybody should be focused on this in the industry, is healthy, durable weight loss. But it's not just achieving your goal, it's what is your lifestyle after you achieve that goal.
Yes.
And that change is what we're focused on.
For any age, right, our goal is healthy longevity,
Yeah.
right? And we need muscle. There is no such thing as healthy longevity without muscle.
So I'll emphasize that sarcopenia, loss of muscle, is the enemy in aging.
100%.
That's the one thing we know for sure about aging.
100%, 100%. And even at a younger age, we see all the complexities and the issues that come with muscle loss. So with patients, for any healthy weight, or when we're achieving healthy weight loss, we have to make sure we monitor body composition. Healthy weight loss is not fast weight loss.
Yeah. Are you finding any withdrawal symptoms when you take them off the medication? Anything neurobiologically?
Like to say to my patients, we're going to go in the weight loss phase, and then when we achieve our healthy weight, then we switch to weight maintenance. So then I start weaning off my patients gradually, and at that point they start to see how their body starts reacting, and that gives me, it's a very good tool to actually empower them and see, like, okay, these are the things that I have to work on.
Got it. Appreciate you guys being here with us today. If you'd like to find out more about Qysimia, visit vivus.com. That is VIVUS, vivus.com, and don't go anywhere.
Important safety information for Qysimia. Qysimia is a prescription medication for adults and children 12 years and older to help with weight loss when combined with diet and exercise. Warning: do not take Qysimia if you are pregnant or trying to become pregnant, as it can cause serious birth defects. Women who can become pregnant must have a negative pregnancy test before starting the medication and use effective birth control. Qysimia is not for everyone. Do not take Qysimia if you have glaucoma, an overactive thyroid, or take MAOIs. It should also be avoided if you have heart disease or allergies to its ingredients. Some patients may experience an increase in heart rate and/or blood pressure, which could lead to heart problems. Do not take Qysimia with alcohol or certain medications. Some patients may experience mood changes, depression, trouble sleeping, or suicidal thoughts. Qysimia may also cause sudden vision changes or eye pain. Seek help immediately if these symptoms occur. Qysimia may result in slowed growth in children 12 years and older. Common side effects include tingling in the hands and feet, dizziness, altered taste, dry mouth, constipation, and trouble sleeping. Use caution when driving. Talk to your doctor to see if Qysimia is right for you. To learn more, go to Qysimia.com or call 1-888-998-4887.